Hello, my beautiful hospice caregivers, my hospice family. Welcome back to Dunn's Hospice. My name is Nurse Dawn, and on this channel, I help patients, families, and caregivers to understand hospice so that they can make informed decisions during one of life's most challenging journeys. Now, if you are new here, please consider subscribing because every week, every day, we talk about hospice, caregiving, end of life education, and many ways to improve quality of life for those who are currently facing serious illnesses. Today's topic is cancer hospice eligibility. Now, this is one of the most common questions that families have asked me in the past as a hospice nurse. They usually ask me, Nurse Dawn, how do I know when my loved ones with cancer qualifies for hospice? Now, you see, many families wait too long because they believe that hospice is only for the very last few days of life. And the truth to the matter is that hospice can help much earlier than most people realize. Before we discuss how someone qualifies under hospice for a diagnosis of cancer, I want us to first understand what exactly is hospice. You see, hospice is a specialized care designed for individuals who have a life limiting illness and whose focus has shifted from curative treatment now towards a more comfortable, and quality of life. You see, hospice focuses on pain management, symptom control, emotional support, spiritual support, caregiver education, and improving quality of life. My hospice caregivers, I want us to understand that hospice is not about giving up. Rather, hospice is living as comfortably and meaningfully as possible. Generally speaking, a patient may qualify for hospice when the physician tells you that your life expectancy is 6 months or less if the illness follows its natural course. Now, as I've mentioned before, nobody has a crystal ball. Doctors, they are not God, okay? So, hospice eligibility is based on clinical indicators and disease progression. The physician looks at the entire picture rather than one single symptom. Now, my hospice family, please take out a pen and piece of paper because I'm going to share with you 7 signs, okay? 7 core signs to look out for that may qualify somebody under hospice care with a diagnosis of cancer. All right. The number one sign is that the cancer is no longer responding to treatment. You see, one major indicator is when the cancer treatments are no longer effective. Perhaps the patient has undergone chemotherapy, radiation, immunotherapy, surgery. You see, and out of all of these, none seems to be working, and the cancer continues to spread. You see, at some point, the burden of treatment may outweigh the benefit. And when that happens, many patients will choose comfort focused care. That does not mean they are giving up. Rather, it means that they are choosing quality over quantity. Number two, the second sign would be significant weight loss. Many cancer patients will experience something called cachexia. Cachexia is severe muscle and weight loss that cannot simply be corrected by eating more food. You may notice loose fitting clothes, prominent bones, muscle wasting, weakness, and decreased appetite. Weight loss often indicates that the body is no longer processing nutrition normally. The third sign is declining functional status. You see, one of the biggest indicators that the hospice team will use is to evaluate the functional decline. And this means, can the patient still perform daily activities? Or are they becoming increasingly dependent? For example, some of the examples include needing help with bathing, needing help with dressing, difficulty walking, increased falls, spending most of the day in bed, requiring a wheelchair. You see, as function declines, hospice may become appropriate. Number 4, my beautiful hospice family, and please, if you are learning from this video thus far, be sure to subscribe, give me a like, share this video. The fourth sign is increased fatigue. Many of my cancer patients will tell me that they are tired all the time. You see, and this isn't normal tiredness. This is profound exhaustion. Even doing simple tasks such as brushing their teeth or walking to the bathroom may feel overwhelming. The body is working incredibly hard. Fatigue often increases as cancer progresses. Number 5, the fifth sign would be frequent hospitalizations. Frequent emergency room visits and hospital admissions are another indicator that the patient needs hospice. Now, my caregivers, if you find that your loved ones is repeatedly going to the hospital, being hospitalized for infections, having pain crises, being dehydrated, dehydration, shortness of breath, difficulty breathing, you see, and complications related to the cancer, then that may mean that hospice might be a helpful tool. It might be time to call hospice because hospice may provide a more supportive and comfortable alternative. Many patients prefer spending time at home, you see, rather than continuously going back and forth to the hospital. Sign number 6 would be uncontrolled pain. My hospice caregivers, pain is one of the most common symptoms that is associated with advanced cancer. Now, this pain that your loved one is experiencing may come from tumors that are pressing on their organs, bone metastasis, nerve involvement, and the side effects of the treatments that they had undergone. And this is where the hospice teams, nurses such as myself, we specialized in pain management. And our goal is to maximize comfort while maintaining as much alertness and quality of life as possible. Last but not least, the seventh sign, the seventh indicator that your loved one who has cancer may qualify for hospice would be if they have decreased appetite and fluid intake. Families often become concerned when a loved one stops eating. Now, this is a very natural part of advanced illness because you may notice that your loved ones will start taking smaller portions. They will become less interested in their favorite foods, increased sleeping, They will start to drink less fluids, you see, and they will tell you that they feel full after just a few bites of eating. And this, my caregivers, this often reflects disease progression rather than your loved ones being stubborn. Now, I'd like to discuss 3 common myths that I hear about hospice, you see, and I'd just like to clear up a few misconceptions. The first misconception is that hospice means death right away, immediately, and that is not true. You see, some patients remain on hospice for several months. Some even improve and are discharged from hospice. Hospice is based on eligibility, not a countdown clock. Number 2, the second myth is that what I hear over my years as a hospice nurse is hospice means giving up. And that is absolutely not true. Hospice means choosing comfort, dignity, and quality of life. The third myth that I often hear is that the hospice nurse, the hospice team will come into my home and speeds up the dying process. And I want you to know, my hospice caregivers, that hospice does not speed up death. You see, our goal is comfort and symptom management. Many studies that I've read suggest that some patients may actually live a lot longer under hospice care because their symptoms are better controlled. You may be wondering also, what services does hospice provide, huh? Well, hospice offers an entire team approach. You will receive help. You'll receive support from the hospice physician. Okay, we have a hospice doctor, hospice registered nurse, we have hospice aide, social worker, hospice chaplain, bereavement support, and also volunteers, you see. Now, the patient and families are never alone. So all of these people will be part of your team to be here to support you so that you're not alone. Another important question that families usually have is they usually ask for, how much is hospice? Is it expensive? Who pays for it? I want you to know that most families pay zero, nada, nothing for hospice care because it is covered through Medicare, Medicaid, and many private insurance plans. And this includes nursing visits, medications that are related to the hospice diagnosis, medical equipment, supplies, and some example of these supplies are hospital bed, oxygen, wheelchair, walker, incontinence supplies. You see, all of these things, my beautiful hospice caregivers, all of these services are paid for under your insurance. And this support, this kind of relief and support can significantly reduce and reduce your stress level and take the weight off of your load. One very important takeaway I want you to take from this video, my caregiver or my patient who's watching this video, is early hospice referral. Please know that hospice works best when the patient comes on service earlier than later. When families wait until the final days of life, they miss out on many of the benefits, as I mentioned, that hospice provides. Earlier referrals, signing your loved ones under hospice care earlier, okay, than later, will allow time for the hospice team, such as the nurse, the social worker, the chaplain. Okay, it will allow us time to build relationships, you see, to formulate an individualized care plan for your loved one. It will also allow time for symptom management, better education, emotional support, and helping you in advanced care planning. Know that the sooner support is available, the more help families will receive. If your loved one has cancer and is currently experiencing significant weight loss, increased weakness, frequent hospitalizations, declining function, uncontrolled pain, and limited treatment options, it may be time to discuss hospice with their physician. Hospice is not about counting days. Rather, hospice is about making every day count. My caregivers, as a hospice nurse of over 10 years, I've seen firsthand how hospice can bring peace, comfort, dignity, and support to families and the patient during an incredibly difficult time of their lives. And that is truly the heart of hospice care. If this video helped you, please give it a thumbs up, subscribe to Dunn's Hospice, and share this video with someone who may need it. Also, my caregivers, please be sure to check out my caregiver Amazon storefront, which is on Amazon, for products that can make caregiving easier. And also check out my book. My book, End of Life is Life. It's on Amazon. I wrote it especially just for you. And always remember that you are not alone on this journey. Until next time, take care of yourselves and each other. God bless.